My name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. What is the role and scope of a psychiatrist? Psychiatrists assess and prescribe treatment for mental disorders such as ADD, ADHD, autism, major depressive disorder, and other disorders in the DSM-5 TR. They can also do psychoanalysis and psychotherapy. They can also do laboratory tests. They can order those. They are able to hospitalize clients who need extra help and prescribe legal drugs to help with major depressive disorder, ADHD, and other diagnoses. Plus, they are medical doctors with at least 4 years of residency in psychiatry. So if you need a diagnosis, you would go see them so they can help you find the treatment you need and get you the specialized help for your specific disorder or treatment plan. So your peer, a fellow graduate student, was referred to a counselor for academic stress. They arrived from overseas around 2 months ago and feel isolated and overwhelmed. They deny experiencing any hostility. They even state it's just the little things like unfamiliar products and food. What aspects of their presentation fall under acculturation adjustment difficulty? A, they have struggled to adjust to a new cultural expectations for 2 months. B, they cannot balance new cultural expectations with their old ones. C, they feel rejection and exclusion by the dominant culture. D, they feel rejection and exclusion from their own culture. The answer is A. They have struggled to adjust to a new cultural expectation for 2 months. They have been here for 2 months and haven't learned anything yet. It would be similar, let's say, if I did a cross-cultural exchange in a different country. I would have to learn new cultural expectations. I would have to learn new behaviors. I would have to adjust to the food, the life. It can be a lot, especially in the first month or two, and I would even struggle with any language barriers as well. And the hygiene products or even food may be different from my own, and for me, I am a picky eater. It would be hard finding new things to try and somewhere brand new to me. So this question, both this client and I would fall under struggling to adjust to a new culture and the cultural expectations. The only psychoanalyst who created a developmental theory which encompasses the entire lifespan was Erik Erikson, Milton Erickson, A. Brill, and forgive me if I say his name wrong, John Paget. And the answer is Erik Erikson. He was the only one who developed from infancy to the elderly across a wide variety of the lifespan. There are 8 stages ranging from birth to death, and in future questions, we will go over them. What is the role and scope of a psychiatric nurse? Psychiatric nurses are the only mental health professionals who have experience in the medical field alongside psychiatrists, and they work closely with individuals with severe emotional problems such as depression, grief, bipolar disorder, anxiety, and more. Their boss would be a psychiatrist, and the psychiatrist can instruct the psychiatric nurse to provide care in medication or other medical care responsibilities, and may delegate some therapeutic counseling and interventions to help with clients in outpatient care. So, for example, if you went to a residential facility, there are psychiatric nurses on the floor to help clients with any issue that may arise, and the psychiatrist will come in and help delegate responsibilities, check in on the clients as well, offer some therapy as well as medication that clients may need, and they can have the psychiatric nurse do that as well. Last question for this episode. A 28-year-old client presents with symptoms of OCD, obsessive compulsive disorder. They report experiencing repetitive thoughts about contamination, which causes them to engage in excessive hand washing. Which of the following interventions is most appropriate to address their OCD symptoms? A. Engage the client to suppress their thoughts about contamination. B. Utilize exposure and response prevention techniques. C. Recommend medication without psychotherapeutic intervention. Advise the client to avoid situations that trigger their thoughts about contamination. So the last two can be removed. Advise the client to avoid situations that trigger thoughts about contamination. That is really, really difficult to do because we live in a world with a lot of contamination, germs, trash, you name it, it's there. And recommend only medication without psychotherapeutic intervention. A doctor can do that, to my knowledge. If I'm wrong, that is okay. And then encourage the client to suppress their thoughts about contamination. Also, that's really hard to do without a lot of CBT. So utilizing exposure and response prevention techniques. This could be simply, hey, here is a potted plant in my office. Just take a look at it with me. Over time, we bring the potted plant closer without stressing the client too much. It's a gradual process. And then having the client stick their finger in the dirt, and then over time, add the amount of time they stick their finger in the dirt, and then you continue the process. And the client can try this at home as well with a little CBT homework. Though it is a slow process, giving exposure to the client and working with response prevention techniques will gradually reduce the OCD symptoms that they are experiencing. And that was 5 questions. Forgive me if I have mispronounced anything. I am learning how to do podcasts, and names trip me up a lot. That's all for now. Thanks for listening. Keep calm and study on.